I'd like to recognize and appreciate the work that TEFINET is doing in highlighting the importance of sustaining field epidemiology training programs for workforce development. My name is Dr. Natalie Mayet. I'm the Deputy Director at the National Institute of Communicable Diseases in South Africa, and the Field Epidemiology Training Program is in my area of responsibility. When we define sustainability, the Oxford Dictionary describes it as the degree to which a process or enterprise is able to maintain or to be continued. And it's literally made up of three pillars generally: the economy, society, and environment. Moore and colleagues conducted a knowledge synthesis of more than 209 articles and identified 24 possible definitions of issues that relate to sustainability. 70% advised that it's the continuous delivery of a program and continued outcomes. Well, just over half related sustainability to duration and time. A third described it as the maintenance of a behavioral change, and 25% referred to sustainability as evolution or adaptation of a program. The context in which we have to consider sustainability for FETP relates to the framing of how we position the program. FETP certainly is part of a healthcare system. So the competency-based training program builds capacity for health intelligence. And I'd like to underscore health intelligence and not disease intelligence. And whilst doing this, it also provides services. Many futurists and economists speak about lead indicators and lag indicators. Lag indicators analyze past performance, and these measure past outputs. They measure, for example, in our context of FETP, the number of graduates per annum. They're easy to measure. They're very hard to change because it's historic data. But the futurists advise that if we want to influence performance and if we want to ensure a sustainable entity, we need to focus on the future. We need to focus on how are we going to produce desired results to meet the need and the demand of the current health system. This is difficult to measure. It's forward-looking, it's projecting, and it's dynamic. And we often tend not to focus on this aspect of those leading indicators. Considering the pivotal elements for sustainability in the program, our focus rests on the input indicators, and our scale generally has weighed heavier on these input indicators, and we propose now that the output indicators need to weigh heavier as we pivot between the two aspects. Our input indicators rests around the programmatic issues, the political buy-in for the program, the institutionalization, the budget, building mentor capacity. And I think we need to focus a lot more on building mentorship capacity for sustainability. But also consider the field placement sites and the supervisors in sites that have not traditionally been considered, like in environmental health, in climate change field placement sites, anthropological and behavioral science initiatives in the field of artificial intelligence. When we focus on the individual aspects of these inputs, certainly our staff of the programs ensuring professional advancement and continuously being ahead of the times. But when we recruit our fellows and our residents for the program, Are we recruiting them for sustainability? What are those personal attributes, the inter and interpersonal skills that are going to promote long-term sustainability? That long-term career path, what are you as an individual going to do to ensure sustainability, not only of the program, but of field epidemiology for future? Certainly, COVID has taught us that we need to build resilience. We need to build resilience, inherent resilience, at an individual level and at a programmatic level. And let us focus on building those resilience and all the components that go with resilience. When we swing on the other side of the scale to our outputs, our focus has to now start being on value addition. And we need to demonstrate that value and quantify it in economic terms of how we've demonstrated those value and add dollar numbers to the value that we've created. So we need to increase the visibility of what we do, our credibility to deliver on what we promised, but to influence those policies. How many policies have we influenced? What policies have we influenced? How have we driven data to action so that we remain relevant? But key to this balancing between inputs and outputs is the networks, sustaining those networks, sustaining the relationships and the partnerships that we build throughout the life of the program. And when we consider aligning behavior with our goals, I've come across this quote which many program directors would relate to: stick to your task till it sticks to you. Beginners are many, but enders are few. Honor, power, place and praise will always come to the one who stays. Stick to your task till it sticks to you. Many program directors are sticking to their task to develop all the issues highlighted in the green boxes. But of importance, when we focus on our data, when we focus on the evidence, when we focus on our right brain issues in terms of sustainability, we also need to plug it into the heart issues and connect with the people that we serve to be able to provide sustainability of our programs. I would like to thank you for this opportunity and also thank all the staff who are working so hard to ensure sustainability of the programs. Thank you.